Chronic pain operates on a different timeline than a standard injury. It's defined as physical distress that persists for more than 3 to 6 months, continuing long after the typical window for tissue repair has closed. This grid represents the United States population, where roughly 25% of people live with this persistent pain every day. The condition usually begins in one of two ways. It can be nociceptive, caused by direct tissue damage like arthritis, or neuropathic, resulting from damage to the nerve fibers themselves. Regardless of the initial cause, both types of pain often fall into the same physiological trap, a self-reinforcing cycle that keeps the body in a state of continuous distress. The first half of this loop is behavioral. Unyielding pain drains energy and limits mobility, which leads to isolation, emotional distress, and anxiety. This psychological stress then alters how the nervous system functions. It heightens the body's sensitivity, amplifying the physical pain signals and making the original discomfort feel more intense. Recovery requires more than treating the original site of an injury. It requires an intervention that can shatter this self-feeding biological and emotional loop. Because this cycle is both physical and neurological, it requires a multidisciplinary toolkit to interrupt the different stages of the loop. We can visualize these treatments as circuit breakers. To address the physical side of the loop, clinicians use physical therapy, acupuncture, and massage. By relieving tissue tension and improving blood flow, these therapies help reduce mechanical pain at its source. Mindfulness and cognitive behavioral therapy act as a second breaker, this time targeting the psychological distress. Reducing emotional stress changes the chemical environment of the brain, preventing it from artificially amplifying the pain signals coming from the body. Finally, lifestyle changes, including optimized diet, consistent hydration, and deep sleep, provide the stabilizing foundation that allows these other interventions to take hold. Combining these treatments creates a comprehensive defense, managing the whole mind-body network rather than treating symptoms in isolation. But what happens when these physical and lifestyle therapies are applied correctly and the cycle still fails to break? This is known as treatment-resistant or refractory pain, a condition where conventional therapies do not provide sufficient relief. In these cases, the nervous system has become stuck in a heightened state of neurological alarm. Standard treatments often fail because the system is too sensitive to respond. To move forward, the brain requires a physiological reset. For these resistant cases, low-dose ketamine infusions provide an advanced medical option. The science behind this treatment involves the glutamate system, which is a primary chemical pathway for signaling in the brain. Ketamine interacts with this system to reset hyperactive pain pathways in the brain and spinal cord, effectively quieting the neurological alarm. This is an adjunctive treatment, meant to be used alongside the foundational breakers like physical therapy and counseling to create a sustainable recovery. Navigating this process requires a personalized plan and a medical team that monitors progress and adjusts the treatment to the individual's specific response. New Life Wellness Clinic is a specialized provider equipped to facilitate this neurological reset. Their team provides evidence-based care designed to interrupt the neurological feedback loop and restore balance to the nervous system. No one has to stay locked in this cycle. Reaching out to New Life Wellness Clinic is the first step toward regaining control.